care of things, more and more and more and more people are going to die. So again, a bad consequence of a bad bill.
Thank you. Thank you, Mr. Chairman. From a state of 1.7 million people, West Virginia has 39,000 people living with Alzheimer's disease. Patients that live in the mountainous rural communities of West Virginia face significant barriers in accessing primary health care, let alone specialized clinical trials. In a 2019 study of one of their clinical trials, WVU's neurology department found that more than 25% of patients had to travel more than 100 miles one way to participate in the trial. Furthermore, patients with neurodegenerative disorders such as Alzheimer's depend on family members or a caretaker to bring them to their clinical trial visits, which only increases the barriers for patients. That's why CMS's National Coverage Determination for Medicare coverage of the Alzheimer's drug Aduhelm and all future drugs in its class is so worrisome. I'm concerned that rural patients won't be able to access an entire class of drugs just because of where they live. Mr. Gonzalez, you touched on the difficulty of having to travel long distances to access tests and studies. Can you tell a little bit some more of the difficulties that patients do face in their ability to participate in these trials?
Sure. Thank you very much for asking the question. It is extremely difficult, and I'm going to go on a different route.
Just do it quickly.
When I have to go somewhere, my wife is with me, so there's two of us each time we're going somewhere. You have costs in travel, you have costs in hotels, then you have costs in meals, you have costs in what you're going to wear, and then at the end of the day, there's the cost in me. There's what's going to happen to me. Every time I travel, it's about 2 days to get myself back to normal.
It makes you tired.
It does, tired and cold and shaky.
Yes. Continuing with the theme of policies which are disproportionately affect rural patients, I'm also concerned about CMMI's accelerating clinical evidence model. This model slashes Medicare payments for drugs approved through the FDA's highly successful accelerated approval pathways until they complete traditional approval. This is entirely nonsensical, and I can't really understand why they do that. Mr. Okon, smaller medical providers, including oncology centers in rural areas, typically operate on a very slim margin. Don't you think that this attempt to slow reimbursements of accelerated approved drugs will have a disproportionate impact on these rural providers and therefore their patients?
Absolutely. It's amazing, Congressman Miller, that the consolidation, that impact of federal policy already has had in independent providers, and that consolidation, especially in rural areas. So what happens? They close the doors.